Phil.
Hi there, everybody. My name is Philip Morin, and I will be giving this training with Liv today as the food security and advocacy manager of Hunger Free Vermont.
Yeah, and so the last thing I want to share before we jump in is that the situation is changing quickly, and the state is making accommodations with the 3Squares Vermont program too, in order to support the influx of folks who are now applying to the program. And so things are changing pretty quickly, and we have some notes throughout the presentation about adjustments that the state has made to the program, and so we'll point those out. But we also don't have answers to every single one of the really great questions that I know you all are going to ask. So we do have a close relationship with our state partners who can help us answer those questions, or at least guide us in the right direction. So with that, I think we'll begin. So in Vermont, 1 in 10 Vermonters, about 10%, are considered food insecure. And that means that they lack sufficient access to the healthy, nutritious food and the food that folks prefer to purchase. Unfortunately, this percentage is even lower, it's even higher for children. It's 1 in 7 children are considered food insecure. And unfortunately, given the situation, it's pretty clear that this number is only continuing to increase. There are many factors that are associated with food insecurity, including low income status, low educational attainment, and health challenges, and health disparities that can contribute to difficulty accessing food and purchasing and preparing food. Unfortunately, on that same vein, there are many consequences associated with food insecurity, including negative physical impacts and impacts on health, as well as poor consequences and economic impacts on individuals and society. But I will give you a spoiler alert. This is the only kind of grim part of the presentation. So from here, we will talk about all the positives associated with 3Squares Vermont, 3Squares Vermont, and how this program is here to help decrease instances of hunger and food insecurity. So today, we will be starting with learning about what is 3Squares Vermont. Next, we will learn how eligibility works and knowing who is eligible. Then, Phil will move on to understanding, utilizing, and maximizing deductions to help clients get the highest benefit, and then walking through the application process to help your clients navigate the process. And then finally, we'll go over questions and wrap up. So our first section that we'll start with is, what is 3Squares Vermont? 3Squares Vermont is a federal nutrition program of the United States Department of Agriculture. At the national level, this program is known as SNAP, which stands for the Supplemental Nutrition Assistance Program. The program was originally piloted in 1939 as a result of the Great Depression, and the purpose of the program was to alleviate hunger. While the program has changed quite a bit since then and has had other names, today it still stands the same, to have the same goal of alleviating hunger. Within Vermont, the program is administered by the Department of Children and Families Economic Services Division, and they're the entity that processes applications and issues benefits. So while at the national level, the program is called SNAP, here in Vermont, it's called 3Squares Vermont, which stands for 3 square meals that the program helps families access. So a couple times throughout this presentation, we'll share different options that states can take and that the state of Vermont has taken to accommodate folks here in the state and kind of mold the program to Vermont's own version. So one of the options that states can take is to call, name the program whatever they want. So in Vermont, it's called 3Squares Vermont. So I'm going to say this now, and I'll probably repeat this a couple times throughout the presentation, but 3Squares Vermont is a federal entitlement program. So everyone who is eligible and qualifies for the program is entitled to receive its benefits. So who can receive 3Squares Vermont benefits? It can be an individual or their entire family. It can be children or older Vermonters. People with disabilities are eligible. Whether someone is working or unemployed, they're eligible, as well as new Americans, college students, and many more folks are eligible for this program. Again, it's a program that is a federal entitlement program, so anyone who is eligible based on program rules is entitled to receive its benefits. No one will ever be taking away benefits from anyone else because everyone who qualifies and is eligible, there's enough benefits to go around. So how does it work? Formerly, the program was called food stamps, and that's how the benefits used to be distributed. Nowadays, the program works by using an electronic benefits transfer card, or EBT, like debit card, which provides a more efficient and anonymous process for shoppers to shop like anyone else at the grocery store. And so nowadays, some people still refer to the program as food stamps. And while that's a name that some folks are still comfortable with, it's just not an accurate way of describing the program. So the way this works is that benefits are deposited onto an EBT card, which is represented in the top right-hand corner of the slide. And so the benefits are deposited on the first of the month. And when someone joins in the middle of the month, benefits can be prorated as well for that first month. Benefits remain on the card for up to 1 year after they're deposited. So if someone is participating in the program in April, and then in May they stop being eligible, if they don't use their benefits for April, those benefits will still live on their card for up to a year after. So in January of 2021, they can still use their April benefits if they still are on the card. There's also a wide variety of places that accept EBT benefits. And so it's not limited to just grocery stores. Folks can use their benefits at stores like Big Lots or many different like small country stores, a variety of farmers markets and stands across the state. And one thing to note about EBT cards is that there might be other benefits living on the card. And so, for example, we're going to talk about next what someone can buy, and it's primarily most food items from a grocery or from a EBT accepting retailer. And so some things that folks can't buy are items like sponges or toilet paper or pet food. But sometimes folks might be using an EBT card to purchase those items. That's because there are other benefits on the card like Reach Up or General Assistance. So folks will be using other programs to purchase other non-food items, sometimes with an EBT card if they are participating in other programs. Another thing to note is that when there are households that everyone is over the age of 65 or everyone is an SSI, which is a Supplemental Security Income recipient, then their benefits are deposited directly as EBT cash on their card, which is the automatic standard, or they can choose the option to have it directly deposited into their bank account. So I alluded to this before, but folks shopping with 3Squares Vermont benefits can pretty much buy most food items. So they can purchase fresh fruits and vegetables. They can purchase grain products like rice, cereal, bread, pasta, dairy products. And when in Rome, of course, folks are going to want to buy a lot of cheese and milk here in Vermont. They can buy meats and seafoods, non-alcoholic beverages. So alcoholic beverages will not count, and folks cannot buy alcoholic beverages with their 3Squares Vermont benefits. They can purchase cold prepared food. So think a cold rotisserie chicken from a grocery store, or like a potato salad from a deli cooler at a grocery store or a place that accepts EBT benefits. They can buy snacks or ice to help support their food storage if they have limited access to refrigeration. They can also buy fruit and vegetable seeds and plants. So as gardening season is coming up, this is definitely something good to keep on your radar. One of the main things that they can't purchase is hot prepared foods or foods from restaurants. And so that's because the primary purpose of this is that you can is that you are meant to bring the food home when shopping with 3Squares Vermont benefits. And so this really speaks to the fact that the key tenets of the program are really focused on hunger alleviation and food choice. So those are some of the basics about 3Squares Vermont. And when you share information about the basics of what is 3Squares Vermont, it's important to speak to the benefits and strengths of the program. So right off the bat, the program is meant to reduce hunger and poverty. And at its core, that's what 3Squares Vermont does. It also helps Vermonters to connect to fresh, healthy local produce by allowing them to shop at local grocery stores and farmers markets. It also helps connect Vermonters to other programs, such as free school meals, as well as other related programs with similar eligibility guidelines like WIC, for example. It helps to improve short and long-term health by reducing instances of food insecurity. And lastly, it helps our economy. For every $1 of SNAP benefits spent in our state, $1.70 worth of economic activity is generated. So those are some of the basics, and now we'll talk about what can we do to ensure that clients can receive their maximum benefit. So we'll start by talking about understanding how eligibility works. We'll then move into utilizing and maximizing deductions. We'll talk about ways to help to support the application process for clients and folks that you work with. And then finally, throughout all of this, we'll discuss some empowering messages and ways to advocate for changes when necessary. Okay, so eligibility is based on two factors. The first factor is household size, household composition. And so a 3Squares Vermont household is considered by people who purchase and prepare food together. So when you think of 3Squares Vermont household, don't think of it as a physical house because there can be multiple 3Squares Vermont households under one physical roof. Along those lines, there are some people who absolutely must apply together. And so that includes spouses and parents of dependent children. There are some folks who might live together but can apply separately, such as housemates who eat separately and are not purchasing and preparing food together. And then finally, there are some folks who are not eligible even though they're living together. So for example, if there's a college student and college students have specific rules, which we'll talk about in a bit, if they're living with other folks who are eligible, that ineligible student cannot be lumped in with their eligible roommates and thus be eligible. So that college student would not be eligible. So as I was alluding to before, there are some folks who absolutely must be included in a household together, even if they purchase and prepare food separately. So the first classification would be spouses who live together. They cannot be separated if they are legally married, if they are living together and representing themselves as spouses, or if they have at least one child in common in the household. The next group of folks who cannot be separated and absolutely must be in the same household are parents living with their children. And this also includes adopted and stepchildren. If these children are under the age of 22, even if those children are living with their own children and their spouse, they must be included within their parents' household. And then finally, children who are under the age of 18, with the exception of foster children, if they live with and are under the parental control of someone who is not their parent, they are required to be in the 3 Squares Vermont household of that adult. So the second part of eligibility is based on income. And so there are gross monthly income limits for households depending on the size. And so these incomes are based on the federal poverty level. Another option that states have the opportunity to take is determining the maximum gross monthly income limit for participants in their state to qualify. So at the federal level, the absolute minimum that a state can take is 130%. The absolute maximum that a state can take is 200% of the federal poverty level. And it's important to note that these numbers will change based on the fiscal year. And so in Vermont, these numbers change on October 2020 and every October after that, and every October before that. So most incomes count with some exceptions, and there are also 2 different kinds of income. So either way, income is based on money that comes in before taxes and other deductions. So the first type of income is earned income, and that includes wages, salary. So if someone is a salaried employee or an hourly employee, their wages will count, as well as self-employment income subtracted by the business expenses. There's also the second kind of income that counts is unearned income. So this includes Social Security, disability, veterans benefits, public assistance, pensions, investments, etc. Very timely right now, but unemployment benefits also count as unearned income. And again, most incomes do count with certain exceptions. The first exception would be any household member who is under the age of 18 and enrolled in high school at least half-time. Any income that they're receiving does not count. Money exchange between household members, between 3 Squares Vermont household members does not count. Lump sum payments such as tax credits like EITC, or when the federal stimulus check comes in, that will not count. What else? There's always a few that I miss. Another one is fuel and heat assistance also don't count. And then Phil, am I missing anything else?
I think you've covered them all now with fuel.
Okay, cool. That never happens. I always forget one. So there are special rules for certain populations. For households with an older adult over the age of 60 and or someone with a disability, they do not have to meet that gross monthly income limit. So that 185% figure does not refer to this household. However, if their income is over 185% of the federal poverty level, then they do have to meet a resource limit, and the resource limit is $3,500. So these resources include savings, checkings, investments, and other assets, but do not count resources such as primary homes, vehicles, and official retirement or educational savings accounts. And then there are some households that are automatically eligible to receive 3 Squares Vermont benefits if they are participating in programs like TANF, or if they're receiving supplemental security income or SSI. Also, I just want to mention that TANF is the national name for a program in Vermont called Reach Up. And then finally, one that gets me super excited is the Vermont Earned Income Tax Credit. And so this is referred to as EITC. So EITC is a great tax credit because working families with children their income can actually be higher than the gross monthly income limit for 3Squares Vermont. And so even if they weren't previously eligible for 3Squares Vermont, when a family receives the EITC, they are more likely to be eligible and should be encouraged to apply, because it's a great way to get more families' feet in the door who might not otherwise have been eligible. So there are more communities that have some special rules associated with their situations. So for example, folks who are experiencing homelessness, there's a common misconception that because someone does not have a physical address at which they reside, they're not eligible for benefits. That's false. So for folks who are applying to 3Squares Vermont and receiving benefits, the main way that the state communicates with applicants and recipients is through snail mail. And so just because someone doesn't have a physical address at which they reside, they just need to have an address at which they can regularly receive mail at. So that could be a friend or a family member's house. It could be an agency's house. An agency's building or mailing address. It could be a shelter, or it could be general delivery at the post office. Youth who are 18 and living separately from their parents are able to apply. If they are under the age of 18, they must prove that they're living independently and not under the control of an adult. College students also have special rules. So a college student would be someone who is enrolled at least half-time based on the institution of higher learning's consideration of half-time. It could also be adult learners who are going back to school, such as through a GED program. They're eligible if they meet one of many exemptions, such as working for 20 hours a week, being younger than 17 or over the age of 50, or participating in a qualifying work-study program. And then finally, for non-citizens, there is a 5-year wait period for legal permanent residence. However, there are many exceptions, such as for folks who are refugees and asylees, as well as folks who are fleeing their home country due to domestic violence. They're able to apply as they get here. It doesn't matter how long they've been here. So there are some folks who are subject to time-limited benefits, which means that they can only receive 3Squares Vermont benefits for up to 3 months within a 36-month period without meeting a work requirement or an exemption. So these are folks who are able-bodied adults without dependents between the ages of 18 and 49. However, before we get too into the weeds about how time-limited benefits work, I just want to note that due to COVID-19, all work requirements are currently suspended because it's obviously incredibly hard to meet one of these requirements. So there are 3 ways to meet a work requirement if folks are not eligible for an exemption. So the first way is to work an average of 80 hours or more in a 30-day period. And so this could be a combination of employment, self-employment, volunteer work, or working for in-kind benefits, which we'll talk about last. They could also participate for 80 hours or more in a 30-day period in a qualifying work training program, such as ICANN. Finally, they can participate in the Work for Benefits program, which includes volunteering at a nonprofit organization. And so the amount of work that they would have to do at a nonprofit organization is based on the amount of benefits they receive. And so the amount of benefits they receive would be divided by the Vermont minimum wage. And so that would equal the amount of hours that they have to work each month to receive those benefits. And then there are also some folks who are exempt from meeting these work requirements, and we'll tell you how. Again, this is just a reminder that due to everything that's going on right now, work requirements are suspended. So some of the ways to still be eligible to receive benefits, even if someone is an able-bodied adult without dependents, is meeting an exemption. So if someone is physically or mentally unfit for work, this can be verified by a healthcare provider, or in certain situations signed off on by a DCF worker. If someone is pregnant or lives with any minor in their household and their 3Squares Vermont household who's not their own child, they are exempt. Certain towns in Vermont, primarily most are in the Northeast Kingdom, and it's on, you can see the full list of towns on page 6 in your manual. These folks are exempt from meeting a work requirement if they live in one of these towns, because there's a labor surplus in these areas, meaning that there are more folks who are eligible to work than jobs available. So this is a pretty common challenge for more remote or smaller areas. If someone is an unemployment applicant or recipient, they are exempt from meeting the work requirement, or if they are participating in a drug or alcohol rehab treatment. So something like AA would count. Finally, if they're caring for an incapacitated person, they would be exempt from the time limit. So as I mentioned before, one of the ways to meet a work requirement is to participate in a qualifying work training program called ICANN. ICANN stands for the Individual Career Advancement Network, which is a employment and training program that came out of a result of a 3-year pilot that Vermont was chosen to try out, called Jobs for Independence. So if folks qualify, ICANN can help them go through the job search process, as well as learn skills associated with looking for jobs, such as resume writing and interview skills. It can help them go through the actual job search process and connect with employers who are hiring. They can also learn and hone job skills that can make them a more employable person and help to gain work experience, as well as industry certifications to access employment. And then finally, one of the things that I think is super cool about the ICANN program is that it helps folks overcome barriers that keep people from working, or helps them access different resources that can help them work, such as, for example, if someone needed to purchase a hard hat or work boots for their new job, ICANN can help them do that. So this program is not just limited to folks who are subject to time-limited benefits. Everyone who gets 3Squares Vermont can participate, except folks who are receiving reach-up benefits. And that's because reach-up benefits, or folks participating in reach-up, have their own program that's very similar, so it would just kind of be duplicative at that point. So we're going to go through an eligibility exercise now, and I also just want to remind everyone that if you have any questions, feel free to send them my way for this section. But also, as we go through this exercise, feel free to send your answers to me. So we're going to go through 2 family scenarios and understand and kind of put to practice the skills that we've learned around eligibility. So when doing this exercise, think first about who within this household absolutely must apply together. So for the first household, there is Sam Stone. Sam receives SSI and AABD, and Sam is the spouse of Sally. Sally is Sam's spouse, and Sally doesn't work. Cindy Stone is their 13-year-old daughter, and Carl Stone is their 23-year-old son. So of the family members, who absolutely must apply together based on the eligibility rules that we just discussed? So as you think through this and you think you have an answer, feel free to send the answer through the chat box. So yes, Sam and Sally absolutely must apply together, but there's one more person within their household who absolutely must apply with them. Yep, that's right. So the first three members of the household, Sam, Sally, and Cindy, absolutely must apply together. So Sam and Sally must apply together because they are spouses, and Cindy must apply with them as their child. Carl, because he's over the age of 22, he can apply by himself. And so Carl can be a separate 3Squares Vermont household. However, he can be included with his family, and that's a good thing when you're working with a household that or you're working with a client who lives in a household that has a couple different household composition options. So in those cases, you can look and see what would yield the highest benefit for the family as a whole. So for example, if Carl is purchasing and preparing food with his family, then he could be included. Or if he's purchasing and preparing food separately, that might actually yield a higher benefit for the whole physical house as a whole. Okay, great. So we can move on to the next one now. So scenario B is the Sanborn family. There's William, who's 59, and the spouse of Denise. Denise is 52, and the spouse of William. Paul Sanborn is 17, and the son of William and Denise. Wanda is 24, the daughter of William and Denise. Tammy Sanborn is age 3 and is Wanda's daughter. And then there's Grandpa Bill, who's 85, and that's William's father. So of these folks, who absolutely must be included in households together? Okay, great. So a lot of good answers coming in, but yes, William, Denise, Paul must apply together. Wanda and Tammy must apply together. And then Grandpa Bill can apply separately. However, there's multiple different combinations of those that can happen. So once you figure out the folks who absolutely must apply together, then you can again see which configurations can lead to them receiving the highest benefit. So it could be a situation that this whole family does apply together, or maybe William, Denise, Paul, and Bill all apply together, or maybe William, Denise, Paul, Wanda, and Tammy apply together, and then Bill applies separately. Um, so there's many various combinations, and Phil will talk about this in the next section, but we have a 3Squares Vermont calculator that can help to figure out what is the what is the benefit that will come out of the various different compositions of households. And so you can use that to figure out what is the best strategy to have a household apply together, or have a family apply together, excuse me. So if anyone has any questions about this last section, feel free to send them along. If not, I am happy to turn this over to Phil now. Thanks, everyone.
Thank you, Liv. Thank you so much for bearing with us bearing with us as we figured out the technology to everybody else on the call as well. Just a few reminders as we move on to the next section, which is utilizing and maximizing deductions. If you all could start directing your questions directly to me, you'll find my name at the bottom of my little square, Phil Moore in Hunger Free Vermont. I will do my best to keep up with them as we go through the preceding slides, and if I need to, I will just ask you to ask your question out loud if it's helpful. I also just wanted to note that I shared a link earlier today, and Liv shared materials in our emails ahead of today's training, but if you need access online to our resources for today's training, they can be found on Vermont Food Help. And also on Vermont Food Help, you can find information about the specific populations that Liv was mentioning, more materials about 3Squares Vermont application, and we are working on updating the website with a section that's specific to COVID-19 and 3Squares Vermont. So if you have questions, you're always welcome to start there, and then Liv and I are always happy to answer what we can, either now or after today's training. Okay. So Liv discussed in her sections household composition and how to determine eligibility based on gross monthly income and what counts as part of that. What I will be covering next is once you determine if somebody is eligible, if a household is eligible to apply for benefits, how do you find out if they're actually going to be enrolled in the program and how much of a benefit are they actually going to receive? And in order to do that, we have to look at the deductions that we're able to take as part of the application. And really that's just taking into consideration the expenses that folks are incurring in their lives. And so we take a look at those expenses and we get that gross monthly income as low as possible in order to make the net income after those deductions qualify a household to participate, and then also determine how much they'll receive in benefit. So again, benefits are based on household size, income, and expenses, and it's the net income after a set of deductions and calculations that determines the household's benefit amount. I will also do my best throughout the slides to share with you folks which deductions can be self-declared, meaning that when I state it on the application, typically no further questions will be asked of DCF. They'll accept it as I report it. And I'll also note when deductions require verification, and especially know when verification might be tricky and some strategy that we can put behind making sure the right information gets in front of DCF. So deductions are very critical in making sure that households are able to get the highest possible benefit that they are eligible for. And so I will also just note, again, that strategy as we go through these slides, because for every $3 change in net income, there's a benefit change of approximately $1. So the lower you can get that net income, the better for the household who needs these benefits. And as Liv mentioned, we do have a benefit calculator at vermontfoodhelp.com where application assisters or clients can go to take a look and see where they might land as far as their eligibility and how much they may receive if they were enrolled in the program. And again, as Liv noted when she started, where there are specific things that are related to COVID-19, the situation that we're currently in now, and the flexibilities that DCF and the federal government are allowing folks who are applying, I will do my best to note those here. And again, we will be updating our Vermont Food Help page with information as those updates become, as they ongoingly become announced. Okay. So the first two deductions that we're going to discuss today are the standard and earned income deductions. And these are two deductions that pretty much just happen automatically without any additional information needed by DCF. So when somebody applies for the program and provides their pay stubs, or doesn't provide their pay stubs because they're not working, DCF is able to apply the standard deduction and the earned income deduction. So for instance, the standard deduction is automatic and is based on the number of people in the household. So when one applies for 3Squares Vermont and they list the number of members in their household, then they will have a corresponding standard deduction. So for households of 1 to 3 members, an automatic $167 is taken off of the gross monthly income, and so on, depending on the number of people in the household. The earned income deduction is based on any earned income reported through pay stubs on the application, and is basically recognizing the fact that there are costs and expenses related to working. And so what DCEF does is they take 20% off of any earned income reported on the application. At the bottom of the page, you will see that there is no additional verification needed. DCF will reach out if they have questions in these situations. The third deduction that we're going to talk about is the child support deduction, and this is what it looks like on the application, question number 36. Essentially, it's asking for the name of the person who's paying child support, the amount being paid, the frequency, and then who it's being paid for, and whether or not it's court-ordered. So this deduction is only for legally obligated court-ordered child support being paid for a child that is not in the 3Squares Vermont household. So for this household that's applying and paying out the child support deduction, this counts as a deduction. But if a household is applying and they're receiving child support, then it becomes an unearned income and must be reported as such on their application. This deduction requires verification. First, court documents declaring that this is legally obligated and court ordered, along with a receipt of payment. So not only is it enough just to say that it's legally obligated, but the household who's applying and using this deduction must also show that it's being received by the other household who is being paid the money. So in this circumstance, a statement from the custodial parent stating the amount paid and frequency would be considered a form of verification that this is taking place. Okay. The fourth deduction that we talk about is the dependent care deduction, and this one is question number 37 on the paper application. And this deduction really is for those households where care is needed so that another household member is able to work, find work, or go to school. So this is, again, just for folks who are working, looking for work, or going to school. And it allows them to, again, take into consideration the cost of providing care for another household member while those activities are taking place. The great thing about this deduction is that it can be pretty informal and that it's self-declared. So folks can include payments made for child or adult daycare services, co-pays for subsidized care, before or after school care, summer camp fees, and then transportation to and from any care that's being provided at a rate of 0.585 cents per mile. And then again, as I mentioned, that this can be a pretty informal arrangement and as simple as having a family member of yours take care of that child while you're doing the activities that qualify this deduction to take place. And this is how it looks on the application. It's just asking for whom the care takes place, where it takes place, and then if amount paid weekly or after subsidy, miles from home to provider, days of week, etc. And again, it does not require any verification unless questionable. And there's also not a cap to how much can be declared as part of this deduction. We have now gotten to the medical expense deduction, which I think of all of the deductions that are on the application, it has the highest burden of verification for those who are hoping to count these expenses towards their net income. So this deduction is available for people aged 60 and over and people with disabilities, and it allows them to claim their out-of-pocket medical expenses. And because there is such a burden of verification, Vermont DCF has a standard medical expense deduction, which allows folks to claim $116 if they're able to demonstrate at least over $35, so at least $35.01 of out-of-pocket medical expenses per month. And again, there is documentation required, and we will go over that in the preceding slides. But they also recognize that out-of-pocket medical expenses are likely over 116 for a lot of households. So if out-of-pocket medical expenses are actually greater than $151 a month, and that's that $35 plus 116, then they can claim the full cost of their expenses. They just, again, have to provide verification for everything. Another really important thing to know about the medical expense deduction is that they are calculating this based on a 12-month look back. So you'd be providing all of the expenses and verification for the 12 months preceding the before the application, and then they would find out what the average monthly out-of-pocket medical costs are and apply that to the application. So what kinds of medical expenses can be claimed? People can claim the premiums that they're paying, their co-pays, and any medical bills that they are actively paying. They can claim the cost of their durable medical equipment, so hearing aids, eyeglasses, dentures, prosthetics, etc. They can claim any home health care and medical lifeline services that they're paying out of pocket. Again, they can claim their transportation to their health professionals, and they can also claim the cost of over-the-counter medications and medical supplies that have been recommended by the doctor. In the past, folks thought that by providing receipts to prove that they are purchasing over-the-counters would be enough, but DCF is very that does not work. The receipts don't actually verify the over-the-counter medications, and that's because it doesn't demonstrate that they're being recommended by a health professional. And we'll talk about how to properly do that in the next few slides. But let me just turn to the question. Somebody asked, does this include co-payments for prescriptions? Yes, it does. Thank you for asking that. So this would include co-payments for prescriptions, and in order to verify that, what they would need is a printout from their pharmacy. Actually, let me just go back to here. As we look at this list, I also like to consider it almost like a hierarchy of what should be verified first. Again, we're talking a little bit about the strategy of collecting information, right? So for premiums, copays, and medical bills, it's likely that the client has copies of those on hand that they can provide as verification that they're paying those things. In the situation of durable medical equipment, that's where you could provide a receipt in order to demonstrate that those things were purchased. Home health care and medical lifeline services, any kind of statement verifying that those are being paid would work as verification. Transportation to the doctor, pharmacy, or any other medical appointment, this is where they'll need to know the distance between where the care is provided and where the person is living so that they can calculate it themselves. And so for this, they could accept things like an appointment card, a receipt from the pharmacy would count as part of this. They could even count any type of stub from taking public transportation, or even if a family member is providing that transportation, they can provide a note saying that they drove so-and-so to here in order for them to see the doctor or to pick something up from the pharmacy. Over-the-counter medications and medical supplies recommended by a professional, this is where it becomes it can become very tricky to verify these items for a couple of reasons. First, again, you have to verify that they are recommended by a medical professional. And second, it can be difficult to have to provide that 12-month look back and really, for these items in particular, and really think, when did I buy Advil? When did I buy Tylenol? Etc. So I like to think that you start at the top of this bulleted list if you're able to find that information. And if you need to provide additional information to get a client to the highest possible benefit, that's where you begin to look at the over-counters. And I'll share some slides in a moment that talk a little bit more about what can be useful when doing that. So again, just looking at this, the question number 38 on the application, it asks, does anyone 60 or older or with a disability pay over $35 a month in out-of-pocket medical costs not covered by insurance? It gives a few examples, but really it just allows the applicant to list the names of those people who fit that criteria, and it doesn't give so much information about what type of verification would be required. For those over-the-counters, typically the Form 120 is one place people can go in order to verify that these items are recommended by a medical professional when they've been listed on the left side of Section 6, and then the dosage is also listed on the right-hand side of Section 6. And at the bottom, it typically has to be signed by a medical professional. I say typically because that's standard in normal practice, but we just actually found out yesterday that during COVID-19 and until we are notified otherwise, the Form 120, this Section 6, can be filled out and taken as self-verified without the signature of a medical professional. And this is fantastic news, as we had been hearing from service providers that it was difficult to get those folks to sign this paperwork for understandable reasons right now. Normally, if someone isn't able to get the Form 120, what also would count is the if their medical professional were to list out something similar, saying, we recommend that Phil takes this medication at this frequency or uses this item at this frequency, and it's printed on the letterhead of the medical professional, that would also count as verification for DCF. Now, one thing that Hunger Free Vermont has worked with service providers to develop is our FMED envelope, so our medical expense envelope. And what this allows clients to do is to basically collect all the information that they're going to need in order to provide verification of their out-of-pocket medical expenses. And as you can see, it includes what counts as verification on here and what can be included as part of this deduction. It also offers application assisters a place to put their contact information, and when complete and filled out, can just directly be mailed to DCF as with the application, etc., and other materials inside the envelope. Okay, so the last deduction that, actually before I continue, if anybody has any questions on this deduction, feel free to just shoot them to me now. And if something seems to pop up in your mind, I'm always happy to go back because that one can be quite tricky. The final deduction is the shelter deduction, and it is questions 39 through 45 of the paper application. This deduction comes last in the series because it takes into account the net income of the adjusted income of the household following the other deductions. And so this deduction allows for shelter costs that are more than 50% of that adjusted income to be counted as an excess shelter cost and thus be deducted from the gross income. After all of those deductions, again, have previously been subtracted. There is a cap of how much can be claimed for this deduction of $569, and that's for all households that do not include somebody who is 60 or older or with a disability. For those households, they don't have a cap and they can claim their full excess shelter costs. let's see, this deduction includes rent, mortgage, insurance on the structure, property taxes paid, repairs due to disaster, etc. And there is, as part of this deduction, a standard utility allowance of $822. And this is Vermont's way of acknowledging the fact that we have high costs of heating our homes for much of the year. And so that should count towards determining what a household's actual excess shelter costs are. So someone can claim the standard utility allowance if their household pays for heat or air conditioning directly or indirectly. So either they pay for it or it's included in their rent as part of the payment that they're making to their landlord, or if they receive fuel assistance. Let's see. Okay. Are there any questions about the shelter deduction before I move on? This one, I will say, just from my opinion, can be a little bit tricky to think about until you see it on the actual application. So we have on our Vermont Food Help website a couple of outreach materials about calculating benefits for different populations. And it's on the backside of those materials that really breaks down the equation for shelter deduction. I've always found that a great place to start if I'm having questions myself. Okay. And then, of course, we also have on our Vermont Food Help website the 3Squares Vermont Benefit Calculator, which allows folks, again, to play back and forth with the different deductions to see what might work for their household. So for instance, if you're working with a client or a household that is utilizing the medical expense deduction and they just use their co-payment, their co-pays as part of that deduction to receive the standard deduction of $116, and that gets them the highest possible benefit when you take a look at this using this calculator, then you wouldn't have to go and collect all of their over-the-counter verification, and so you save yourself that additional work. But if you find at any point in that person's certification period that they're no longer receiving the highest possible benefit, you can go back, take a look at what they could be claiming in addition to that medical expense deduction, additionally as part of that medical expense deduction, excuse me, and then provide that information to DCF to receive, again, that the highest possible benefit they're eligible for. Okay. Now, section 4 will cover the application process and different points during which application assisters and advocates can help and step in to make sure that people are successfully navigating the process. Oops. Right, so I think maybe we've all heard that this application is complicated and requires a great number of steps and follow-up in order to complete it. And often that is the barrier for folks who are not receiving benefits because they just can't get through the actual application. So there is a lot that we can do to make that process easier. And as I've stated, we'll go through and I'll share some of the tips that we've actually been collecting from service providers over the year, and also share some of the flexibilities that DCF has taken, has been approved for by the federal government during COVID-19. Okay. I wish the application was as simple as these 8 boxes and arrows make us think, but no, there's a lot that must happen during this time, and there are a lot of places, again, where folks can get tripped up. The place that we like to start with is really understanding where folks can actually get the application and how they can apply. And so applicants can fill out an application on paper. They can submit an online application. They can fill it out on paper and then fax it in. They can even go in, typically in person, to a district office to apply right there and then with an application assister, with a benefit specialist, excuse me. So if somebody wants to request an application, they can go to mybenefits.vt.gov. That's also where people can apply online. They can call the benefit specialist hotline at 1-800-479-6151. You can find a place to request applications on vermontfoodhelp.com. You can go to, typically you can go to any DCF or Economic Service Department office to get one. And community action agencies and area agencies on aging, they also have applications and can also provide application assistance to people. Right now, during COVID-19, what is recommended by DCF is that people apply online or apply via the paper application and mail it in to the application document processing center. They are doing their best not to take walk-ins at their district offices in order to maintain social distancing. Okay, so once, regardless of how you apply or submit that application, once the application is received by DCF and uploaded into their system, basically a 30-day, well, excuse me, not basically, a 30-day clock begins, during which time a determination has to be made. So this can be tricky because that's a lot of information to lob back and forth within a relatively short amount of time. But inversely, it means that the client will have a determination and won't be waiting for an undue amount of time in order to find out the status of their application. Now, the tip that we have collected from service providers is that before an application is submitted, that they make a copy of it for the client to hold onto for the future. This gives the client something to look at when This gives the client something to look at when they need to recertify, when they have to report during the interim report, etc. Let me just take a look at the questions in the chat box. Somebody asked about the document uploader and and yes, people can use, in addition to applying online, people can submit their verification directly through the Agency of Human Services document uploader. And this is a fantastic tool that I'll share a little bit more information about shortly. But we also have received, and then the second part of that question was, and get verbal permission to sign on their behalf. We have actually confirmed with our DCF partners that people who are applying need to either sign the application themselves physically or be the person to submit a telephonic signature, and that verbal permission over the phone and a verbal signature is not acceptable at this time. Someone else wrote in, I have seen that the food bank has people who can assist with applications. I've seen the yes, the Vermont Food Bank does have application assisters as part of their staff, and we have in many of our materials the information that people can use in order to be in touch with them. So if somebody is looking for an application assister and you're not able to provide that, you can always call 211 to find out the closest community action agency or area agency on aging to that person who needs assistance. And I will also find out the information for the Vermont Food Bank. I just don't have it at the top of my head, unfortunately. But also there are staff members at many food shelves across the state who are able to provide application assistance too. And many, many other people who also provide application assistance. Somebody just also asked about new Americans who can't fill it out themselves and can't get face-to-face help from the district offices, I believe. Sorry, this is just coming in quickly. So essentially the question goes on to ask if a new American who doesn't speak English is applying for benefits, they can work with an application assister, and there are other things that they can do that I'll mention in a moment, but they can work with an application assister to fill out the information, and then they still would have to sign physically their signature on that in order for it to become effective. And then somebody else has asked if whether or not there has been an increase in benefits because of COVID-19, and I can answer that question. Yes, Vermont has received a waiver from the federal government to apply emergency benefits to what households who are enrolled currently receive. So if a household wasn't already receiving their highest possible benefit, they will receive an additional deposit to their card to make the difference up. And that is for March and April, and they will receive those funds at some point in April and May. And then, okay, I think that covers everything. And if it doesn't, I'm hoping that these next few slides will help out, and then I can come back to any of those questions later. Oh, perfect. Okay, so this is what the online My Benefits page looks like when somebody is trying to apply online. And so you would have to create an account here with an email address. The applicant would have to create an account here with an email address, and then follow the preceding steps in order to complete an online application. Something that Liv and I have been pointing out to people is that the copyright at the bottom of the page does still say 2010, but this is still the place where you would go in order to apply online. Okay, so we also just wanted to note what verification is typically needed, and I'm going to add the COVID-19 updates at the end. So typically required verification would include verification of income through pay stubs, verification of child support paid or received, any of those resources if needed, the medical expense deduction, those things that need to be verified on that end. And then there is some income that can be data matched by DCF, and that includes Social Security benefits and unemployment through the Vermont Department of Labor. So no verification would be needed for those. Some expenses can be self-declared, included dependent care and shelter costs, unless questionable typically. But at this time, again, I'm just trying to think of all the things that are being accepted as self-verified. So end of work verification is being taken as self-verified. Self-employment is being taken as self-verified. The Form 120 is being taken as self-verified. Liv, am I forgetting anything that came up yesterday? I think those are, I think currently those are the things that are being taken as self-verified outside of normal procedure. And it's important that, you know, we know this either now or during regular times, because not providing the necessary verification to DCF during that 30-day time clock is the #1 reason for procedural denials, which means DCF has to say no to that client because they're not able to get the verification necessary to complete the actual application. Okay, so there is also the option of expedited benefits for those households that are in emergency situations, and essentially these are for folks who have who for some time have had not consistent income, and they also have no resources to tap into in the form of savings and money in a checking account perhaps. So the state can approve their application without the typical income verification, and they would then have their benefits issued within 7 days. It's important to note in this situation for folks who have received expedited benefits that in order for them to continue receiving benefits, they do have to provide they do have to complete the rest of the application within that 30-day period in order to continue receiving 3Squares Vermont. I'm just trying to think, is that everything? Oh, and also at this time, and even during normal DCF is actually pre-screening all applications to see whether or not benefits should be expedited. And on the application, it's question number 5, and basically, I'll just read it. It says, you may be eligible to get 3Squares Vermont benefits within 7 days if your household has less than 150 in monthly gross income and less than 100 in liquid resources, cash on hand or in the bank. If your household includes a migrant or seasonal farm worker and the household receives very little income now and then or no income at all and has less than 100 in liquid resources. If your household's combined monthly gross income and resources are less than the household's monthly rent, mortgage, plus utilities. So those are situations in which a household would be able to get expedited benefits. Okay. So normally once an application is received and uploaded into DCF's system and that 30-day time clock begins, one of many automatically generated notices is sent to the address on the application. So this first notice of interview, informs the person applying that they have to call in within 5 days in order to complete an interview with a benefit specialist worker. A caveat about this is, not even a caveat, something to note about this is that that interview can happen within 5 days, but it can also happen basically during any point in that 30-day time clock. But the point is that an interview must normally take place in order for the application to continue. A phone interview is standard, but many clients can request in-person interviews or reasonable accommodation. And what happens during an interview is a benefit specialist will go through the entire application with the clients to ensure everything is accurate, to ask questions or to provide answers for questions that the client might have, and to provide next steps. Typically at the end of the interview, the benefit specialist would inform the client of any outstanding materials in order to complete the application. And to somebody's question earlier in the chat box about those new American households who may not speak English, there is an interpretation line to conduct their interview with an interpreter in their preferred language. And so what would be recommended of that population or an application assister who is working with them would be to call the interpretation line at 1-855-247-3092. And if you just, as we understand it, if you just say interpreter or interpretation, then they will connect, they will work to connect that client and whoever is offering application assistance to somebody who's able to work in the language that they prefer. I mentioned that a notice of interview is generated automatically, and if an interview is not conducted within 5 days, a notice of misinterview is sent to the client's address. We really encourage folks to call in for their interviews as soon as possible. And when they call in as soon as possible, even if they complete their interview, it may still generate those notices of misinterview if it happens kind of on that line of that 5th day. So just let clients be aware that they can call in for their interview as soon as possible, and that if they do fall on that line, that they may still receive a notice in the mail. So if they fill out their application online and then call in for their interview maybe an hour later and they conduct it, they're still going to receive that automatically generated piece of mail. Okay, I'm going to pause here for a moment because that was all about normal times. And during COVID-19, please note that the interview is not taking place as it normally does. So during COVID-19, DCF has been accepted for a waiver that allows for interviews to be skipped at this time. So if somebody applies, they do not need to call in for an interview. DCF will reach out to the applicant or the application assister, if noted, to gather any additional information that they need in order to complete the application. So just to reinforce, the interview is not happening at this time, and if somebody, if a benefit specialist needs additional information, they will contact the phone numbers listed in the application. Okay, this is what a notice would look like. And again, typically during an interview, the benefit specialist will review all of the documentation needed and provide what is outstanding. And so typically, if somebody is in their interview and they complete the interview and the benefit specialist marks it as complete, another notice will be generated saying what's outstanding and then sent to the client. And that client would have that applicant would have 10 calendar days to submit those materials back to DCF. And in the past, it is still tricky because those are 10 calendar days and not 10 business days. And they also include the time it takes for those documents, that notice to get from DCF to the client's address. So it may take a couple of days depending on how far away that client lives from Waterbury, or how quickly they check their mail, etc. And this is a tight deadline. And so again, this is often the number one reason why applications time out and aren't able to be completed. So we really encourage folks to send in as much verification as they know they'll have to ahead of time, and to use the document uploader now that it's available. Let's see, with consideration to COVID-19, again, if somebody submits an application, DCF will be directly in touch to see what additional verification would be needed. And if that occurs and they need something, I would just rely on that document uploader. Okay, so let's say the applicant has made it through and has provided all of the information that they need to. They've been able to successfully conduct all of the activities in order to be enrolled. DCF will send them a determination of, yes, you are able to enroll in this program. No, you're not able to enroll in this program, and here's why. And then they'll also send, for those folks who are able to enroll, notice of how much they should expect to receive in the form of a monthly benefit. The first month benefit is a prorated one depending on when it's approved during the month. So typically, if we remember what Liv said earlier, benefits are deposited on the first of the month. If a household is approved, let's say on the 15th, they're going to basically get the prorated amount for the remainder of the month. And then at the start of their first full month, they'll receive their full benefit on the first of the month. An average monthly benefit is about $216 per household in our state, and it tends to be a higher benefit for families or households with more than one person, and less for households of just one person. 9 out of 10 households receive about $50 or more in an average monthly benefit. We think this is very important to note because folks will often say, the benefit isn't high enough for me to even take the time to apply. And we like to come back with, well, actually 9 out of 10 households receive $50 or more. And that could be quite a bit of money toward helping make sure that folks can be successful in meeting their food needs. It can make a real difference. It is possible to be eligible for a $0 benefit, but it is very rare. And this typically will only happen for those households who are categorically eligible and are able to enroll based on their enrollment in other programs, but their net income isn't low enough for them to get an actual benefit. We'll talk about this a little bit more perhaps later, but we encourage folks to accept enrollment in the program when this is the case, because if their situation changes, all they would have to do is report that change to DCF, and their benefit would likely go from 0 to an actual nominal benefit. It's also, I'm just going to go back and say again that DCF has been approved by the federal government to issue emergency benefits. So if a household wasn't receiving their highest possible, their maximum benefit before, they will receive the difference for their March benefit in April and for their April benefit in May. Yes. So for instance, if I had been enrolled in 3Squares Vermont by myself, a household of one, and my monthly benefit was $100, and that's what I had in March when the state of emergency pandemic was declared, I would receive in April the difference of the benefit I had received in March and the maximum benefit. So I would receive an additional I would receive an additional $94, excuse me, an additional $94. And because the April benefit has already been issued, the difference would be received in May. Okay, and yes, so as I mentioned, there is the possibility of a $0 benefit, and so it's possible to meet that gross monthly income test or have categorical eligibility, but not have a net income low enough to receive an actual nominal benefit. And once again, encourage clients to keep their cases open or active so that they can report changes. This can be extremely frustrating. I recognize that, but imagine if you had worked with a client who just 2 or 3 months ago had been working and had a $0 benefit, and you had convinced them to actually enroll with that $0 benefit. If now, because of COVID-19, they have been unemployed and they need they need additional funds to put food on their tables, all they would have to do is report that to a benefit specialist at DCF, and there would be a likely change in how much they receive from zero to a nominal benefit. Is there any questions about any of that before I move on? Okay. So when a household is enrolled in 3Squares Vermont, they are enrolled for a certification period. So basically the amount of time that they'll continue receiving benefits. And that is either 12 months or 24 months. And for most households, it's going to be 12 months, but for households with a member that is 60 or older or with a disability, they will be certified for 24 months in this program. And that certification will that certification is if they successfully perform an interim report midway through that period of time. So if I'm certified for a 12 months certification period, I would have to fill out an interim report at 6 months. And they would receive those interim reports directly in the mail from DCF, and they would have to fill them out and return them back to DCF in order to continue receiving benefits for their full certification period. And those interim reports will ask households to report any changes in household composition, residence, their vehicles or resources, or any other circumstances. And we encourage folks to get that back to DCF as quickly as possible. Note during COVID-19 is that any household in March or April that was up for recertification, excuse me. So their case was coming to a close. Any household that was up for that in March or April has been automatically pushed back for 6 months, pushed forward. So they'll continue receiving, they'll continue being certified. If you were expected to end benefits in March, you will continue to receive benefits until September. And if you were expected to end in April, you'll continue to receive benefits until October. And then also during this time, the interim report is being paused and people do not have to provide those reports to DCF because of COVID-19. Otherwise, what you see on the slide is regular standard practice. So say the client has, oh, question in the box, one moment. Someone just said in the chat box that they were working with a family that received a letter requesting updates and that they lost some benefits. Is that being sent 6 months? So if a household is certified for 12 months, they will receive that interim report at the 6-month period, and whatever they report in that interim report will have an effect on their benefits. So if they report that they've received a higher income, then they would likely see a decrease in their benefits. If they've seen if they've added a new member to their household who brings in more income, they would likely see a change in their benefits. But if they brought in a household member who has no income, they would maybe perhaps see an increase in their benefits. That is standard practice, but with COVID-19, if they had already filled out that information and sent it into DCF, they should be, because of the emergency benefit waiver, receiving the highest possible benefit. So if there's a situation like this where you're not certain, it might be useful to reach out to the benefit specialists to ask when during this time if my household would be eligible for the emergency allotment, and they should be. And for the person who's writing in, if you have additional questions, please, you could feel free to email me directly and I can try to follow up with you on this situation, but that's how I believe it to be. And I can't speak to Reach Up. I only really can speak to 3Squares Vermont in this case. Okay, so typically, you would only have to report during the interim report in order to stay certified for the full 12 months. And there are only some things that you would have to report outside of the interim report, which we will touch on in a moment. If your certification period is coming to an end, I think it's about 6 weeks prior to that. Yes, 6 weeks prior to that closure, the client will receive a notification in the mail saying that they have to reapply. So they would reapply and go through similar steps as in the initial application, but with greater ease and less reporting needed, and then would either be determined to stay in the program or no longer be able to stay in the program based on their net income. So other than that interim report, the only time that somebody would have to report to DCF is if they had an able-bodied adult without a dependent in the household who loses a job, reduces their hours of employment, or has any changes on their status, or if their household gross monthly income had been below 130% of the poverty level when they applied, and it has reached 130% or more during a calendar month. They would have to report that to DCF, and that's because the 130% is the federal gross monthly income standard, and as Liv mentioned earlier, Vermont has taken 185% as our gross monthly income test, which means that the program is available to more people because it's able to capture folks who are who have gross monthly incomes in excess of that 130%. It's important to note here, though, that really Vermont's simplified reporting stance is a good thing, because it means that there would only be during the interim report the need to report changes if there isn't something that's mandated by these two situations here. So otherwise, we recommend to folks that they encourage clients to only ever report changes to their client, to DCF, to the benefit specialists, if it will lead to an increase in benefits. So anytime a household's income goes down or they incur accountable expenses, we encourage clients to report those changes so that they may be able to get a higher benefit. Okay. Just to recap some of the tips that we have discussed in the other slides, and perhaps a few additional ones that maybe I've missed. Before an application is submitted, make a copy for your client to have on hand. If you can, submit as much verification along with the initial application so that there's nothing outstanding when the interview is conducted. Encourage clients to call for their interview as soon as possible during regular times, and again, during COVID-19, an interview is not necessary, and DCF benefit specialists will reach out if they need any additional information. Stress the importance of submitting verification as quickly as possible. And one I didn't mention, but is true, a signature on an application with the proper amount of contact information is sufficient to start that 30-day time clock. And for some clients during normal circumstances, that can be the extra push that they need just to complete the application. I wouldn't recommend that at this time, considering just the sheer number of people who are applying for benefits and how overwhelmed the call centers are with folks who are trying to get through the steps. But yes, if somebody absolutely needed to, they could do this. And the last two are really in recognition that I'm human, you're human. The folks working at DCF who are processing these applications and making determinations, they're human. So if you believe that something has been done incorrectly, you are encouraged to reach out to DCF to see if a mistake was made or if you are actually eligible for a higher benefit, etc. And even then, if that doesn't, if you're not satisfied with the results, clients have a right to appeal any decision by DCF. But hopefully, again, sometimes things can be solved without having to go through that very formal process. Okay, so we have actually covered quite a bit of information, and we are kind of coming to the close of our presentation. I just have a few more slides to share with folks, and then I will release you to go about your days and continue doing the great work that you're doing for folks all across our state. But we just wanted to note a few things before we do that. So participation in 3Squares Vermont reached an all-time high in January of 2013, and that was about 102,000 Vermonters were participating during that time, and that was in response to the recession that was occurring starting in 2008. So really, we include this point here because we really want to emphasize the importance of this program during times of economic shift, and we're certainly in one of those times now. So 3Squares Vermont has the ability, so SNAP and 3Squares Vermont has the ability to really respond and help people through situations of economic downturn. Before COVID-19, participation had been declining to an average of around 70,000 participants per month, and we will likely see that number increase as a result of COVID-19. And the average length of participation was about 9 months to a year. We also include this point that 1 out of 4 eligible Vermonters are not participating. So that eligibility is based on their gross monthly income. So 1 out of 4 folks is not applying when they likely would be able to receive benefits. And that's where being able to work with application assisters or being able to access correct information is really important in making sure those people have the tools they need to be successful. Who is actually enrolled in 3Squares Vermont typically? So as of December 2019, 32%, we received a snapshot from DCF, 32% of recipients were children ages 0 through 17. 22% were older Vermonters, and of all the people enrolled, 20% were folks who had a disability. So really, 3Squares Vermont is there to help folks out and is a resource for anybody who is eligible. And I've believe this is the last slide, yes. So we've gathered for you here some of the tools that we've been developing over time and continue to develop, and I've mentioned it throughout the presentation, and Liv has mentioned it. We have Vermont Food Help as a resource to all of you, and this is something that we update frequently and with the help of service providers who are a part of our 3Squares Vermont work group. It's a collection of folks who work for community action agencies, the area agencies on aging, the Vermont Food Bank, and we come together. They all send representatives to come together and to have discussions around what materials are needed to make sure people are getting the help they need, and we then put those materials on Vermont Food Help for folks to access. We also, during this time, have a page on our regular Hunger Free Vermont website with information that we're keeping updated about resources for folks who need additional help accessing food during this time. We also have a 3Squares Vermont e-update that sends out quarterly updates normally, and updates when they are especially needed. So we might be sending more relevant information out now that things are developing with COVID-19 and the state is able to take on more flexibilities. So you can sign up by just emailing Liv or I, and we can get you signed up, or you can even just sign up on our Vermont Food Help website, actually. And then lastly, we have our 3Squares Vermont Benefit Calculator, which is a tool that we hope you all find useful. But on that note, if there are other things that might be useful to you all, you're always more than welcome to email. And if it's something that exists, we'll point it out to you and share it with you. But if it's something that we might want to consider exploring, we'll work with our partners to develop for you all. On that note, I'm going to stay on for some extra questions if you have them, but otherwise you are more than welcome to leave today's call and go about the work that you have planned.
Thanks so much, everyone.
Thank you.
Thank you.